We used to joke, but it wasn't really a joke, that the fastest Kenyan marathon runner could run a marathon and a half before you get an ambulance.
Many of us have heard about the emergency line 911. However, in Kenya, it is a dream that one day emergency response time could be reduced to what is about 162 minutes to a shorter time, and this can make all the difference.
It was a system you never thought about. As you were taught about it when you were in school. You know, the fire department or the police department would come and teach you about 911. And you hoped you never had to use it, but you never thought twice if you did. And you knew that if you called 911, you'd hear the sirens before you hung up. And so living in Kenya, I was constantly reminded. I was working in healthcare, and everyone just had a story. What if my grandfather got to the hospital faster? Or you would witness a road accident and realize that it was just completely chaotic. Everyone was surrounding, a victim on the side of the road. Or you'd hear about a mother losing her life because she couldn't be moved from one facility to the next because she needed an emergency C-section.
Kathleen Dolkat is the managing director here at Rescue CO that is trying to solve the golden hour problem through technology by providing medical response using both ground ambulances and air evacuation, as well as roadside assistance, including towing, recovery, and security.
On average, we are 15 minutes in cities like Nairobi, Mombasa, even Nakuru, Nyeri, and 25 minutes in remote and rural areas. Whereas fast, though, is sometimes 2 minutes. And so we really try to be there as quickly as possible. And so we cover over 2 million individuals across the country, from tourists coming into the country to individuals through their health insurance, to county governments who cover mothers and newborns, to businesses that cover their workers, or motorbike drivers. And so when they call us, they've already subscribed to the services, and so there's never a question about.
This is Rescue. What's the location of emergency? I'm here to help, but first I'll be asking a few questions. Kindly answer all of them as best as you can.
Here, we also meet Lawrence Peter, who is a shift lead here at the Rescue Response Center. Their work involves receiving emergency calls, collecting victims' details and their emergency before dispatching the nearest rescue.
And then based on that information, then we dispatch the most appropriate resource to attend to that case. And as the ambulance is en route, we also go a step further and provide medical instructions so that whoever has called, if they are able to, or even the patient themselves, can start doing some things to alleviate the situation even as they wait for the ambulance.
And even though rescue seems far when the need arises, availability of ambulances and shift response could make it easier to save lives.
We have over 200 ambulances in Nairobi alone. Across the country, over 1,000 ambulances. It's just that every ambulance is coordinated independently. And so you as a patient would have to call literally thousands of numbers to be able to understand who is nearest to you. And you don't have time. You can't do that, in an emergency. And so we centralize all of that. We also standardize all of the care that's provided by these various ambulances to ensure that even though it's 1,000 ambulances, you have a uniform system and service that is delivered to you.
Through partnerships with counties, it is possible to turn things around when it comes to emergencies to just 12 minutes and reducing incidences such as mother and child mortality.
But if everyone pays a little bit, whether that's through social health insurance or whether that's through private insurance, it actually becomes affordable.
Robbie Omondi, K24.